Hi there, my name is Mohammed and I'm a third year medical student studying in London, and welcome to my channel, and I hope you are having an amazing day. So in today's video, we're going to talk about type 2 respiratory failure. If you haven't watched my last video, which was about type 1 respiratory failure, I'm going to link it down in the description below. So as we said in my last video, respiratory failure is what happens when the lungs are going to fail at fulfilling its main function, which is taking oxygen in from the atmosphere and getting carbon dioxide that is building up in the body out into the atmosphere. Okay? So in today's video, we're going to talk about type 2 respiratory failure. We're going to go over its definition and how it's diagnosed and what are the things that can potentially cause type 2 respiratory failure. So this sounds interesting, then let's get right into it. So type 2 respiratory failure, just like type 1 respiratory failure, is going to be diagnosed by getting an ABG. Okay? An arterial blood gas. So again, an ABG is going to involve taking a sample of arterial blood where we're going to analyze and see the partial pressures of oxygen, the partial pressures of carbon dioxide. It can tell us also about the lactate, the levels of lactate, the pH of the blood, and can also tell us the values of the different concentrations of the different electrolytes in the blood. So it can tell us lots of information about what's going on in the patient. Okay, so say someone with type 2 respiratory failure has presented to A&E and we did an ABG on him. What will the ABG show? So the ABG is going to show a high PaCO2 with or without a low PO2. So someone with type 2 respiratory failure is going to have hypercapnia or a high partial pressure of CO2 with or without hypoxia or a low oxygen. Okay? So what causes type 2 respiratory failure? Unlike type 1 respiratory failure, which is caused by a number of things which can lead to hypoxia, type 2 respiratory failure, the only cause that can lead to type 2 respiratory failure is going to be hypoventilation. And as we said in my last video, hypoventilation is when there's going to be less fresh gas from the atmosphere traveling from the atmosphere and reaching the alveoli, and as a result there's going to be a reduced gas exchange leading to the buildup of CO2 in the blood. And if there's a buildup of CO2 in the blood, what's going to happen is there's going to be a respiratory acidosis, okay, where the pH of the blood is going to reduce. Okay, so the only cause of type 2 respiratory failure is going to be what? It's going to be hypoventilation. Ventilation. Okay, cool. And there are a number of causes of hypoventilation. Okay, so what are the causes of hypoventilation? So the first cause is going to be neuromuscular disorders. Okay, what kind of neuromuscular disorders? Okay, let's write that down. Such as Guillain-Barré syndrome, such as motor neuron disease. Okay, what else can cause type 2 respiratory failure, or what other things can cause hypoventilation? Chest wall disorders such as kyphoscoliosis. Okay, chest wall disorders. Okay, what else? Some drugs can actually cause hypoventilation, such as what? Such as opioids, which can cause respiratory depression, as well as barbiturates. Okay, when someone has an overdose of morphine, we give them naloxone. Okay, and what else can cause type 2 respiratory failure or ventilation? Obesity. Okay, when someone has obesity, the chances of them having sleep apnea increases, and sleep apnea is when there's going to be a partial or complete obstruction of the upper airway, which can potentially lead to hypoventilation. Okay, what else? giving oxygen to someone who is retaining CO2 can cause hypoventilation. And we're going to explain how that happens in a separate video because this is really interesting. Okay? Giving oxygen to a CO2 retainer. Okay, so neuromuscular disorders, chest wall disorders such as kyphoscoliosis, drugs such as opioids, such as barbiturates, obesity leading to sleep apnea, and lastly giving oxygen to a CO2 retainer. So this is basically an overview about what type 2 respiratory failure is. If you enjoyed the video and found it informative, please leave a like and subscribe for more videos like this, and I'll see you next time.